No wonder we are shockingly seeing people being treated in corridors when the number of beds have been significantly reduced over time by the SNP. Compared to 2012, there are nearly 100 fewer beds at the Royal Alexandra Hospital in Paisley. That's nearly 1 in 8. And the Vale of Leven Hospital has seen 1 in 8 beds cut during that time too. Over the last decade, over 60 beds have been lost at Inverclyde Royal Hospital. That's almost 1 in 6 beds. And as we heard from Jackie Baillie, a process that was started whilst John Swinney was Finance Secretary, and now we see John Swinney as First Minister, plans for a further 22 beds to be cut at the RAH in Paisley, with the proposed closure of Ward 36 for older adults. That is despite the views of nearly 6,000 local people who have signed a petition opposing the closure of this important ward. Serious concerns have been raised and so far have been ignored about the impact this will have on patients and the pressure it would put on the wider hospital. There should be a full public consultation, but there hasn't been any, and the Health Board are pressing ahead with their controversial plans. Unison reps at the RAH tell me they want to work in partnership, but not on the closure of this ward. The Scottish Government therefore need to intervene. Presiding Officer, we heard from Jackie Baillie, the Cabinet Secretary, and the First Minister had a meeting last week to discuss the NHS, but regrettably did not invite Unison. Will Unison reps who raised concerns about staff morale at the RAH want to meet the Cabinet Secretary to discuss the need for a consultation and to keep Ward 36 open? I've said repeatedly that the Cabinet Secretary should attend sporting events where appropriate, but frankly, if he's got time to attend football matches and intends staying in post, then surely he's got time to take the ministerial car to the RAH in Paisley and meet representatives of the staff there who are working on the front line. If it helps, we can call it a boxing match. And I look forward to hearing from the Cabinet Secretary whether he will take time to accept this invitation or duck it from NHS staff.